The title of his talk is Holistic Healing, Continuities of Care Beyond the Clinic. Michael, it's all yours.
I'm an MD PhD student in anthropology and have done fieldwork in Sierra Leone since 2013. My involvement in the Ebola response began when the only maternity hospital was forced to shut down and pregnant women were being left in the parking lot. I didn't choose to study issues pertaining to maternal mortality, but I was surrounded by it. My thesis utilizes existing community health workers as a means of data collection for identifying and addressing barriers to maternal health. This research partners with female Ebola survivors of rural Port Loko, Sierra Leone, to inform innovations in the implementation of maternal care by illuminating the holistic needs of mothers before, during, and after pregnancy. To contextualize the methods of community health workers, history of drug-resistant tuberculosis provides the clearest example. When the WHO guidelines declares it was impossible to treat drug-resistant TB in settings of poverty, partnerships between community health workers and clinicians enabled a proof of concept that if the potent side effects of medications were offset with social support, food, and daily home visits, success rates nearly reached 100%. The Port Loko community health workers are experienced in reproductive health research and providing continuity of care before and after medical treatment. Our efforts now focus on the urgent issue of maternal mortality, where 8 unnecessary deaths occur every day, nearly half of which are younger than 19. The goals are to investigate the systems of oppression at the source of these poor health outcomes and to expose the vicious cycles reproducing barriers to care by describing the interrelatedness of extractive industry, a colonial legacy, and pressures placed on young women to bear children. The power of this work is the potential for scaling to places such as Detroit with equally dire disparities in maternal health. An average maternal mortality rate 3 times the national average, where Black women are also 4.5 times more likely to die. Fortunately, for Detroit, there is growing opportunity as Governor Whitmer recently committed millions of dollars to the Healthy Moms, Healthy Babies initiative, calling for thousands of new slots for home visits, which is the foundational component of this research. Why? Because of its proactiveness. For example, at-home blood pressure tests can flag high-risk pregnancies months in advance, buying the patient time to initiate preventive care. Although geographically different, mothers in Port Loko and Detroit are both afflicted by histories of structural violence and limited access to standard models of care. Uniting anthropology with medicine broadens the perspective of social inequities to catalyze more resilient health system strengthening. For example, in Sierra Leone, preliminary results point toward mobile surgical units for servicing the most isolated patients. The next steps are to better align with existing efforts in Detroit for discovering the most appropriate innovations to meet the unique demands of its high-risk population. Awards from competitions such as these will enable the demonstration of a similar proof of concept to bring these interventions to scale and a sense of urgency when there is no time for further delay.
Thank you, Michael. Really interesting. Very nice. Michael, what challenges do you anticipate for implementing your findings?
Well, there are many challenges, especially those that we can't anticipate. I think one of the greatest challenges, probably the moral ethical dilemma of speaking to the previous question of defining and identifying who we're studying, because each population has unique problems and risk factors that are afflicting them. But hopefully the point of the presentation was that if we can scale this intervention and this methodology for one population, it can be translated to many others.
And many other disease situations, I guess, as well.
And other locales, absolutely.
Yeah. Okay. Great. Thank you. Oh, it looks like there's another question for you, Michael. Okay. If there are resources available and the problem is well known, how is it that such harms continue to be recreated even in the U.S.?
So hopefully that is what anthropology can help us to identify. A notion of historicity is an important concept in anthropology, which basically means providing alternative narratives of history from those specifically who are not in positions of power. And this helps us identify the political economy of current issues, which means how are economies and relations of political power within capitalism contributing toward decision-making. And these analyses can illuminate systems and structures that have been inherited based on previously discriminatory policies and gives us a chance to recreate them according to modern values.
Right. Interesting. Okay. I think we'll probably